Good morning, everyone. This is Roberto Yunes from Washington, from the World Bank Institute. I would like to start apologizing for the problems we had in getting images from Octavio, but we can start right now. I would like to welcome you all to the fourth of a series of webinars that the Institute and the World Bank Institute is developing as part of the network of Salud Derecho on issues related to the litigation and the right to health. We have today Dr. Octavio Luis Mota Ferraz, who is a lawyer from Brazil and is currently a professor at Warwick University, Warwick Law School in England. Dr. Octavio Ferraz has a long career in the law area. He has a PhD in law from the University College of London. He has a master's in medical ethics and law from King's College in London, and he has his law degree and master's degree in law from the University of São Paulo, Brazil. It's also important to note that Dr. Octavio Ferraz was also a senior research officer at the Right to Health Unit at the Human Rights Center at the University of Essex, where he had an opportunity to work with Professor Paul Hunt, who was the UN Special Rapporteur for the Right to Health, as you probably all know. So without further delay, I would like to give the floor to Professor Octavio Ferraz.
Obrigado. Okay, thank you everyone, and sorry as well for the technical problem. I'm not sure if it is on my side. It probably is. The computer equipment here is brand new, but not working properly as it seems. I would like first to thank Roberto Yunes and also Leonardo Cubijos and Antonio Paniagua for the invitation. It's a pleasure to be here today sharing some of the data and arguments of my own research on this topic of right to health litigation in Brazil, some of which is already published, mainly in two pieces, which you can see there in this first slide, a chapter I wrote for a book that was published by Harvard University Press last year, and another piece I wrote for the Texas Law Review, but also some data which has not come out yet, but will be coming out in several places, including the report of the Priority Setting, Equity, and Constitutional Mandates in Health project of the World Bank, in which I was responsible for the Brazil chapter. So the topic is right to health litigation in Brazil and its social impact. And it's the main hypothesis which I try to test in my research is the one about this broader question about litigation and social change. Can courts exercise a progressive transformative role via litigation? What we could call the transformative hope was born mainly through the inclusion of social and economic rights through litigation in constitutions all over Latin America, including the Brazilian Constitution of 1988. So the basic idea is, if health, education, house, food and water are now expressly recognized constitutional rights, legal professionals, in particular judges through litigation started by lawyers, can exercise a positive transformative role in their societies by forcing the political powers to implement these rights when these powers fail to do so. And right to health litigation in Brazil seems to give us a good opportunity to test this hypothesis, given not only the inclusion of the right to health in the Brazilian Constitution, which I have already mentioned in Articles 6 and 196, but also the fact that individuals and groups have been actually invoking this right in the judiciary since at least the mid-90s, and there has been an exponential growth in right to health litigation in the past decade in Brazil. So we can look at the data emerging from this phenomenon in Brazil to illuminate the issue, the complex issue of whether litigation can bring about social change or not. So let's look at the numbers of litigation, right to health litigation in Brazil first. In the slide you have there now, you have the volume of litigation and the growth in its volume from 2003 to 2011 at the federal level in Brazil. So you can see a huge increase from only 387 cases in 2003 to 12,811 cases in 2011. But the important thing to note about this piece of information is that it might be only showing the tip of the iceberg of litigation in Brazil. And to understand that, I have to explain briefly that Brazil is a federal state which is divided into 26 semi-autonomous states, which in turn are divided into more than 5,500 municipalities. Now, given that the Constitution doesn't separate very clearly the duties and responsibilities of each of these three different units as regards health and other services that should be provided for the population, we have the situation in which someone who believes that her right to health has been violated can file a lawsuit against each of these three levels, the federal, the state, or the municipality, or actually even all of them at the same time. So to know the real scale of litigation in Brazil, we would have to add the figures we are seeing there to the figures of all of the 26 states plus all of the 5,500 and plus municipalities together. Now, the scale of the task is obviously daunting, but it is being tried by the Ministry of Justice, and we have preliminary results of research which is being carried out in this field, which shows that there are an approximately 240,000 lawsuits in the health field around Brazil. But this is still preliminary data, not published yet, so we are better off not using it. But we have some published data on the state level as well, which I'll be showing later. Before that, I would like to look at the expenditure that this huge volume of litigation gives rise to. So you have again like a huge increase from 2003, when we had only 171,000 reais being spent, to 243 million reais in 2011. I have to note that the figures here are actually in Brazilian reais and not in US dollars, so sorry for the mistake, but you can simply divide it by 2 and then you have the figures in dollars. So we are talking about more than $120 million being spent only at the federal level with right to health litigation in 2011, and it's probably even higher than that already in 2012 and 2013. If we look at the state level, and only selected states, as I mentioned, we don't have the complete picture yet, you see that in some states, like São Paulo, expenditure is even higher than at the federal level. So we have more or less double the amount spent at the federal level in São Paulo at the moment, at $200 million. These figures are in dollars, and the slide is correct. If we look at other states of the south and southeast of Brazil, you can see significant expenditure as well, like in Santa Catarina, $45 million, Rio Grande do Sul, $40 million, and Minas Gerais, $20 million. So what the data shows so far is that it's clearly a significant phenomenon, both in volume of litigation and in expenditure. But how should we evaluate this phenomenon from the perspective of social impact? What is the social impact of this so-called judicialization of health in Brazil, which is creating so much cost at all levels, the federal, the state, and the municipality levels for governments in Brazil? So is it positive, neutral, or negative? Or to put it another way, does it improve the protection of the right to health? And how should we evaluate this? Another very complex question, because it depends on the way you interpret the right to health, which was included in the Brazilian Constitution, as already mentioned, and people disagree about the interpretation of this right. So let's look first at Article 196 of the Constitution, which recognizes the right to health. It goes like this: health is a right of all and a duty of the state, guaranteed through social and economic policies that aim at reducing the risk of illnesses and other harms, and that the equal universal access to services and actions for the promotion, protection, and recuperation of health. Now, I think the most important concept to highlight from this legal provision is that of equal universal access, because depending on how you interpret this, you will reach different, perhaps even opposite conclusions in the question of what is the social impact of health. Yes, just to clarify, the figures I was presenting were all about public health rather than private, as I see someone was asking earlier. Now, going back to the question, how do we interpret the right to health in the Constitution? Two possible interpretations are available. The first one sees litigation and the increase in expenditure that it produces, as shown by the graphics I've just mentioned, as always positive, whoever benefits from it, because it forces government to increase the provision of medical services and thus comply with the constitutional principle of universal access in health. The other possible interpretation, which is the one I favor and adopt, sees the problem in a different manner. For this approach, litigation can be positive, neutral, or negative. It's not always positive. And this is because, given that resources for health are limited, no health system in the whole world, even in the richest countries, is able to afford provision of health care and other health benefits without limits. So the impact of health litigation cannot be measured by, in the way the first interpretation tries to do it, which is by expansion of health services for individuals who litigate. It has to rather look at the impact of that on the equity of the distribution of these scarce resources for health. So two questions have to be asked if you adopt the second approach, which I favor and will adopt from now on. Who is benefiting from this significant expenditure of resources? And equally importantly, who is losing from that? Now, this is what we could call the profile of litigants in right to health litigation. And to build an exact profile of the litigants, it's not an easy task. To know who are the thousands of claimants who are going to courts to try and enforce their right to health is a daunting task, and to know who is losing is even more difficult, since these individuals are invisible in litigation. They are not there in the lawsuits for us to try and gauge their profile. But I think that the research which has been carried out so far by me and others can give us nonetheless a very good, a fair idea of the profile of litigants, and also a good idea of who the likely losers are for us to try and shed some light on the question of the social impact of litigation. So let us look at this data now. Now, one way of trying to measure, to define the profile of litigants, which has been attempted in several pieces of research, is to look at the type of legal representation and medical services used by litigants. So the idea is this. If the litigant uses a private lawyer to bring his lawsuit to the court, and is an habitual user of private health services, it's likely that this litigant will be richer, will be a litigant coming from the higher socioeconomic strata of Brazilian society, since both legal representation and medical services in the private realm are not affordable to the poorest individuals. So several pieces of research, with the exception of a couple of studies, found that legal representation in right to health litigation in Brazil is mainly done through private lawyers. I'm not putting the percentages here because they vary a lot, but in some studies it was found that more than 70% of litigation had private lawyers representing individual claimants. As to the medical services used, the data is more mixed, and it's more or less half and half in most studies. But the problem with this data is that rich individuals can also use public legal representation and public medical services, sometimes deliberately, to make their claims before courts more likely to succeed. So we have to look at other indicators to determine the profile of litigants. One way of doing this was attempted first by Fabiola Supino Vieira and Paola Zucchi in a seminal article that was published in 2007, in which they analyzed 170 lawsuits that were brought against the municipality of São Paulo in 2005. So what they did was they found out in each of these lawsuits where the litigant lived, their place of residence, and then plotted this on the map of São Paulo to gauge in which districts these litigants lived. And we have very good data about vulnerability of individuals in terms of social and economic indicators, depending on where they live in São Paulo. As in many cities in Brazil and Latin America, São Paulo is a highly stratified city in which the rich tend to live in the center and the west, whereas the poorest tend to live in the east and the south. So each dot in this map represents a lawsuit claiming some health benefit, and you can see that very few dots are outside that area with the least social vulnerability in São Paulo, and almost no dots are found in the extreme east, south, and north, which is where the poorest live. So this is a good indicator as to the socioeconomic profile of litigants. I myself, inspired in part by the study of Vieira and Zucchi, conducted an empirical research at the federal level looking at 4,343 lawsuits brought against the federal government. And again, the same pattern found by Vieira and Zucchi was found by me in this study. So 93.32% of the lawsuits, 4,013 of my sample, were concentrated in the 10 most developed states of Brazil, whereas only 6.68%, that is 330 lawsuits, came from the 17 least developed states of the country. The right-hand graph shows that more clearly. The vertical axis is volume of lawsuits, and the horizontal axis is index of human development. So you can see that the further to the right and to the top you move, you can see the concentration of the most developed states of Brazil in terms of social economic development. So you have the Santa Catarina, Rio de Janeiro, Minas Gerais, São Paulo, Rio Grande do Sul, and Paraná as the champions of litigation, so to speak, and they are all also, as is known, the most developed states in São Paulo. Now, the same pattern can also be observed when we look at litigation against states. So the previous graph showed litigation against the federal government divided by where they originated from at the state level. This is litigation against the state itself. And again, we found the same pattern, and this graph illustrates well by comparing two states with a similar size of population, Rio Grande do Sul in the south and Bahia in the northeast, but with a huge difference in volume of litigation. So if you look at the volume of litigation in Rio Grande do Sul, which is one of the most developed states in Brazil, you see that it approached 8,000 lawsuits. It's more now, we know, in 2007, whereas in Bahia, which is one of the poorest states of Brazil, it was only 112. So we can see from this data presented so far that there is a significant correlation between level of development measured by IHD, Index of Human Development, and the volume of litigation, and that applies to all levels, the municipalities, states, and the federal level as well. Now, this is obviously not proof beyond doubt that litigation is being captured by the elites or the middle classes, but it's a strong indication, I believe, that this is taking place in Brazil. Now, one of the criticisms or challenges I get every time I present this data, or every time I used to present this data at least, was that litigation can be progressive when it is conducted by public lawyers in Brazil. In Brazil, we have two institutions which are there to represent the poorest who don't have access to justice. They are the Public Defensory and the Public Prosecutor's Office, whose legal remit is to represent these people and therefore try and enhance their access to justice. So I always get the challenge challenge, so to speak, that at least this type of litigation conducted by public lawyers can have a transformative impact. So what I did, together with a colleague, Danielle Wang from the University of São Paulo and now at the London School of Economics, was to try and measure and test whether the smaller percentage of cases which are indeed conducted by public lawyers rather than private lawyers can have a potential transformative effect, and therefore we should be concentrating our efforts in expanding that type of litigation rather than criticizing right to health litigation as a whole. So here is the data that we found in our study. So we looked at 340 cases brought by the public defensory in São Paulo, and another 32 filed by the public prosecutor's office in São Paulo as well, between 2006 and 2009. So just to re-emphasize, the remit of these two institutions is expressly to represent those who cannot afford private lawyers to litigate. So our hypothesis was, at least in this smaller percentage of right to health litigation, there must be a positive social impact. That is, the poorest will be represented in these lawsuits brought by these two institutions. But the picture that emerged was rather different, and in a way also indicative that the potential impact of right to health litigation is not that positive, even in these smaller percentages of cases. So if you look at the graph, we've tested again through geographical area of litigation where most of the litigation came from. So for impact to be really positive, we would expect most of the litigation conducted by these two institutions to be on the left of the graph there, which shows low human development index. But the fact is that even these institutions end up by concentrating most of their cases, 51% in the cases of the public defensory and 55% in the cases of the public prosecutor's office, on the medium and high areas, in the areas of medium and high human development in São Paulo. So to put it the other way around, only 49% of public defensory cases and 45% of public prosecutors' cases are come from areas of low human development index. Now, an even more surprising finding of our study was when we divided this litigation by another index, which is called the Health Need Index, which was developed in the city of São Paulo to help public health officials to allocate scarce resources in health. So, according to this index, São Paulo is divided into three main areas. One which has low health needs, which is on the left of the graph there, one which has medium health needs, and one which has high health needs. So again, for litigation to be really transformative, we would expect that at least in these cases represented by public attorneys, it would be concentrated on the areas with high health need. But only 42% of the public defensory cases and an even lower 14% of public prosecutors' cases is concentrated in these areas. We have still a very high number of cases emanating from areas with low health needs, 14% in the case of the public defensory, and 27% in the case of the public prosecutor's office. So most of the data, which is admittedly incomplete and can be challenged in several ways. Maybe some of you will challenge this in your questions. Nonetheless, shows a picture which I think should give us who believe in the potential of social transformation to law at least reason to be cautious and not to embrace litigation uncritically as always a positive tool for social change. Now, I would like to use the rest of my time to talk a bit about why this focus on rich and poor. Some might challenge me by saying that the fact that litigation is currently concentrated on the richer or is brought by the richer people, relatively richer in Brazil, is not negative in the sense that surely the right to health is a right of everyone, rich or poor. So it should not matter much that litigation is currently benefiting the richer. This is a good start, one could say, and we should focus now on this expanding litigation to reach the poor as well, as some at least of this litigation carried out by public attorneys seems to be doing. Now, the reason why I find this position untenable is twofold. Firstly, because I think it's unlikely in the foreseeable future that access to justice will be independent on social and economic status. I think that for the foreseeable future, the richer will always be more able to use courts through the hire of private lawyers than the poor will be through these institutions of public attorneys. But even if that wasn't the case, the fact that resources are scarce, and I again emphasize this point, make it impossible to expand the health system to cover all the needs of everyone, rich and poor, for all medical conditions that they happen to have. Now, given that that's impossible, hard choices will always have to be made, and some individuals and groups will be excluded from the health system when these allocation decisions are made. Now, in a highly unequal country like Brazil, as this graph which you are seeing now shows, which is about infant mortality, but almost any other health indicator would show the same pattern. That is, that the poorest, which are there on the left, have the worst health indicators, sometimes significantly worse than the richer, which are on the right. So in a country with a situation like that, and with scarce resources to spend in health, I think that health equity would demand that most resources, if not all resources, are focused on health issues which are a priority for the poorest. Otherwise, paraphrasing my colleagues at the University of São Paulo, Virgílio da Silva and Fernanda Terrazas, what litigation will be doing is mainly excluding the already excluded, or to put it the opposite way, including the already included. Those who have already got the best health indicators in the country will be able to get even more resources through litigation at the expense of the poorest. Now, to finish, I would like to show another couple of graphs which I think illustrate well the problem which I've been trying to show so far. So here is a graph that shows the volume of litigation per capita divided by the regions of Brazil. So if you look at the two poorest regions, which are the North and the Northeast, which have the lowest or the worst health indicators, you see that litigation per capita is very low. So one lawsuit per more than 400,000 individuals in the North, and one lawsuit per more than 170,000 individuals in the Northeast. When you look at the richest regions of Brazil, you can see the volume of litigation growing and reaching the high level of 1 per 11,000 in the state, in the area of the South, which is the most developed of Brazil. Now, another important piece of information which has just come out in another study of the federal government, a huge percentage of the costs of litigation is concentrated on a very small number of lawsuits in which only 20 medicines are demanded. And they are obviously very costly medicines, which sometimes, or often actually, have to be imported by the Brazilian government to comply with litigation. So here you see that 78% of the costs of litigation at the federal level, which is about 190 million reais or $90 million, where this graph is wrong again, sorry, it should be Brazilian reais there, is spent to fund only 632 lawsuits or patients who have won in court the right to be provided with these 20 more costly medicines. Now, is this an equitable way of allocating scarce resources in health? Is this really improving the protection of the right to health in Brazil? I hope that by now you know already what my answer to that problem is, but to that question is. But before I move on to conclude, I would like to show you another study which I find very interesting, which summarizes, I think, the problem I'm trying to highlight here. It was conducted by two Norwegian academics, Siri Gloppen and Ole Norheim, and they looked at the 5 most demanded drugs in the state of São Paulo in 2010. They then classified these drugs using criteria that health experts use in the allocation of scarce resources, and they found that none of those drugs were considered as a high priority in terms of effectiveness, severity of the illness they treat, costs of these drugs, and the strength of the evidence. So they are all classified as low priority drugs in terms of this criteria. So as well as inequitable health, right to health litigation, when it's focused on these drugs, as seems to be the case in most of Brazil, is also wasteful. It's wasting precious resources of the health system in treatments which are not even considered as prioritarious in terms of effectiveness by health experts. So to finish, my conclusions are this. I think most of health litigation is conducted by private lawyers on behalf of individual claimants coming from the richer states, cities, and districts of Brazil. Even litigation conducted by private attorneys seem not to reach the poorest individuals and groups in our country. Most of the expenditure generated by litigation goes for the acquisition of a small group of very expensive drugs that benefits a very small group of patients. This has a likely regressive effect due to the expenditure of resources in a manner that does not diminish Brazil's significant health inequalities, and therefore, even for those of us who believe in the potential transformative impact of law, we should be cautious not to see litigation as always a benign practice and promote it uncritically as a tool for social change. Thank you very much, and I'm now happy to have questions that I will try to answer in the best way possible.
Yes.
Yes?
Yeah, could you please go through the questions that you prepared on the multiple choice questions and see based on your presentation, how the participants would answer them?
Okay, should I wait for them to finish answering it then?
Yeah, one at a time. Yes, please.
Okay, so when do I know they have finished?
No, we'll let you know. But I think, yeah,
Thank you.
I think, yeah, when you see the data stabilizing, I think you should. It's okay. Yeah, I think the first one is done.
Okay, so litigation is almost always a positive tool for the protection of the right to health. Strongly disagree, only 4.76%. Disagree, 33%. Neither agree or disagree, no one. Agree, 52%, so almost always a positive tool for the protection of the right to health, and strongly agree, 2, which is almost 10%. So should we move to the second one?
In your presentation,
Okay.
how do you read those answers?
Well, I deliberately put almost always a positive tool for the protection of the right to health there, which gives this result agree, which is most of the people who are watching it, is scope for interpretation. But I think that most people are still very hopeful that litigation can be a positive tool for the protection of the right to health. I think that the data doesn't warrant such an optimistic position, but people obviously, or at least a significant part of the people who watched it, disagree. It would be interesting to see what their background is like in terms of profession lawyers or health experts or health economists. Whereas I think there would be huge variation in the answers according to professional background.
There's the second one.
Mm-hmm. The impact of litigation should be measured simply by the expansion of provision in the public health system, irrespective of who benefits and of costs. Yeah, this is the challenge to my emphasis on always dividing litigants into rich and poor. So let's see what people think about that. Ready?
Yeah, I think we can.
Yeah, so that's interesting. So most people strongly disagree, and there is only one person there agreeing. So I think that perhaps people are convinced, something which the Brazilian Supreme Court hasn't been convinced yet of, is that it's impossible to expand the provision of services in the health system without limits, irrespective of costs. So to link that with the answer to the first question, so maybe people are disagreeing with me there that litigation is benefiting mostly the richer people, and it's not being concentrated on health benefits, which should be regarded as a priority. Because if you agree that it's impossible to expand the system without limits, then you have to make choices how to spend scarce resources. And if you're spending them mostly on the health benefits of the rich, then I think you have a clear case of inequity here. So maybe people are disagreeing that most of the litigation is benefiting the richer, and they believe that it's benefiting the poor as well. We'll have to see. Third, the impact of litigation should be measured by its impact on the equity of distribution of scarce resources in the system.
It seems that we have kind of reached.
Okay, so 50% agree and another 15% is strongly agree, which again, I think reinforces the answer to the previous question, but there is still one person who strongly disagree, perhaps the same one who agreed with the previous question, and 25% who disagree. So it would be interesting to know what criteria then, if not the equity of the distribution of scarce resources, should be used to assess the impact of litigation. But again, those who agree or strongly disagree, who seem to be the majority, are probably disagreeing, therefore, that the impact in Brazil currently is negative in terms of health equity. Okay, fourth, health equity in highly unequal countries means giving priority to health. I can't read the full question here, but it's
The question
health
is,
actions.
health equity in highly unequal countries means giving priority to health actions and services that benefit the poorest.
Mm-hmm.
So, yeah.
Okay, so the vast majority now agree or strongly agree with that, and only a couple of people representing 10% disagree. Okay, so not even my criteria, which is sometimes challenged, seems to be the explanation for the answers given in the first question. So it's probably an assessment of health litigation as benefiting the poorest by most people there, which is explaining our difference of opinions. So the final question. The current pattern of right to health litigation in Brazil has likely regressive effects. I can't read the rest either, but I think it's clear.
It's likely to have regressive effects, yes. Otavio, we only have 5 minutes. Maybe maybe you can test some of so you can go through with the Q&A part. Maybe some of these issues that you raised, you observe from the set of 5 questions would come up. in the Q&A.
Great. Okay, so it's interesting. Most people are going to agree and strongly agree. So I would like to hear why they also agree that litigation is almost always a positive tool for social change.
You have some comments that are quite interesting.
Yeah, okay.
Castillo Duarte has an interesting comment. In a country where it's usual not to observe the law, litigation is essential.
Yeah, I would say, again, that litigation can have a positive impact, as it has had in other areas, but at least in right to health, I think we should measure the impact of litigation and then make up our minds. And it seems that at least in this area, we should be more cautious. If the courts are benefiting mostly people who have already got higher levels of health than most of the population in the country who depend on the public system, then perhaps in this case at least, litigation is not essential. It's actually creating more problems than solutions. Law is not the only way to resolve the social problem.
We have a specific question from John Thorpe.
Okay, John Thorpe.
Yeah, it says if Brazilian litigation is excluding the poorest and siphoning off funds from important health initiatives, is the answer more judicial deference to public health agencies or administrations? Have studies shown any rich-poor bias in these organizations?
Yeah, in my view, the answer is or should be more judicial deference to public health agencies. I think Brazil has a strong tradition of public health, starting with Oswaldo Cruz, Carlos Chagas. We have highly competent people working in public health agencies. Of course, it's not perfect. There's also some bias there towards the rich, but I think if we compare the political institutions with the judiciary, I think the political institutions are more porous to the need of the poorest in society. Programs like the family health program are clear examples of how the political powers do things that benefit mostly the poor. The problem is that this is unlikely to happen given the high level of judicialization in Brazil in all areas and the acceptance at the moment that courts can get involved in any political issue whatsoever. So the solution is more towards trying to educate courts that resources are scarce and they have to be fairly distributed, and trying to make them review the fairness of the allocation of these resources rather than giving to individual patients all health benefits that they seek for in the courts. We have time for more questions, or?
Yeah, if maybe some final comments on these, on some of the observations that are showing up regarding the courts may not have the tools or may not be the right instrument to solve social problems.
Yeah, again, this is a contentious issue, especially in countries like Brazil, where, as I've said already, judicialization is growing, and there is this sense, which I think some of the people who are watching this seminar share, that litigation can be a tool for progressive social change, especially when political powers are deaf to the needs of the poor. So there is this strong, almost instinctive feeling that the political powers are always corrupt and the courts can come to the rescue and make sure these political powers comply with their constitutional duties. Especially when you constitutionalize these rights, that becomes what I've called in the beginning of the presentation, the transformative hope that lawyers and courts can perform this transformative task. But I think that courts are not only not institutionally capable of doing that, even if they wanted, but as the Brazilian data shows, they are not seemingly willing even to do that. They could perform, I suppose, less negative role if they tried to review in this right to health litigation the criteria that political powers are using to allocate scarce resources, the transparency of these decisions, some biases in these decisions that might happen, but in the way they do it, which is by providing individual treatment to individual claimants, the effect is the opposite. So it's not only a matter of institutional capacity, but also, I believe, of lack of willingness to look at the problem as a problem of health equity and of prioritizing the health needs of the poorest. If the problem is that, and I think most people agreed it is, then I think that we are more likely to achieve results through the political branches. However much corruption and inefficiency there is at least some interesting initiatives coming from there, like the family health program I've mentioned already, which clearly have a focus on the poorest of the poor. So to sum it up, I think that we sometimes, especially lawyers, are too optimistic about the transformative potential of courts and too pessimistic about the transformative potential of the political powers. And perhaps we should revise this position and focus our resources, which are also scarce, campaigning at other fora like the political powers, for instance, and leave courts aside for a moment in this fight for the implementation of social and economic rights.
Thank you very much, Otavio. I think we need to close now. We extended a little bit since we started a little late. We wanted to give you a full hour. I think we had an excellent discussion, and we would like to invite all participants to come and join us for the next session, which will be in about 3 weeks or so, about a month from now, on May 14th. And the topic, the theme of the next presentation is going to move us from Brazil to Chile and discuss judicial protection of the right to health in that country. So the topic of the next presentation in Spanish would be La protección judicial del derecho a la salud en Chile. So we invite you all to come and join us on May 14th for the 5th series of this webinar series. I would like also to ask you, as always, to please fill the evaluation forms that we have. It's going to take you just a few moments. And these are very important for us so we can improve our webinar series in the future. Well, once again, we're going to leave it open for a few moments, the questionnaires. But from here, from Washington, on behalf of the Institute and in the World Bank Institute, I would like to thank you very much, Octavio, for an excellent presentation and discussion. And thank you all participants. You always make some very interesting and very compelling comments and contributions to these discussions. Thank you all, and I'll see you in about a month. Thank you.
Hey.